Good morning and welcome. My name is Megan Lancaster, for those of you who don't know, and I will be service coordinator today. Today's reflection, Universalism is Medicine, will be given by Dr. Lynn Peterson. I welcome all of you today, and we, the congregation, welcome one another, most particularly those of you who may be visiting us today. If you are new to North Chapel, consider signing the guest book, which is at the back of the sanctuary. Also know that there are hearing assistance devices and large print hymnals in the back as well. Small note, small change, our lemonade and refreshment will be in the foyer today instead of out in the hot, humid sun on the front porch. This is also the time where if you have any devices that might make noise, you turn them off or silence them. Yes, my phone is off. Hey, I've had it go off while up here, so you know. So thank you for being here this morning, and again, welcome. If you would join me in our opening hymn.
I'm going to begin by saying that age 44, I dropped out. Why? Well, I was pretty successful in the sense I had a very busy surgery practice. I was teaching things that I liked and had medical students that found enchanting at the Harvard Medical School. But I dropped out. Now, there were a lot of things there. My wife, Nancy, we had this 15-room home and 2 acres in Newton. And while it was sort of the dream of her life, it was too much. Just, it ended. She didn't love it anymore. Kate and Matt, our 2 children, had to go to a new school. 12 and 5, had to change schools. Prices in the housing market skyrocketed. So we said, well, maybe this is the time to take a move. More importantly for me, I guess I'm trying to look for a little thoughtfulness for my family, but I needed a break. I was at the end of the road for me. I had some very good papers published in science journals and surgical journals, etc. But I couldn't carry forward. I couldn't move forward. It was something was hung up. And then at Georgetown University, I wrote a letter to the head of the department, the principal, actually the president of Georgetown, saying that I thought, we were making some mistakes. And he agreed and invited me to come to Georgetown for a conference on ethics. And I didn't even realize this kind of thing existed. So I went there for a week in June. It was a nice summer week in the DC area. It was beautiful. And there were nurses there, there were lawyers there were sociologists there, and there were some other doctors there. It was amazing, and we talked about ethics. I never heard about ethics in medical school. I graduated in 65, I guess, or something like that, and nobody talked about ethics. Ethics, what do you mean ethics? So we talked about ethics, and I was just amazed, and I found my soul there. And so when Nancy got tired of this house, or overwhelmed actually, it wasn't just being tired, it was just, she just couldn't see around the corner anymore. And so we decided, let's see if we can go to England. I applied to Oxford, and they had a good program in ethics and philosophy. It was accepted. And so we agreed, and we went off to England for 2 years. Now, I didn't know whether I was going to ever come back to Harvard at all. I had actually sort of lined up a job in Stanford in California, because Nancy said, if anything, I'd love to live in California. Okay, so we're going to kill two birds with one stone. I'm going to go back to study psychology, philosophy at Stanford, and Nancy gets to live in California for the last half of our married lives. After a year in Oxford, and it was the best time of my life, for sure. And the kids were fantastic. They joined in with their new schools. Nancy was happy, and it was really great. So after a year, I got a call from the dean at Harvard. And he wanted to know if I'd be interested in coming back. And I was tickled by that possibility as a new job. And it was going to be a job in social medicine, not surgery, social medicine. Wow, that was interesting. And so it was January, I remember going there and interviewing, talking with people, etc. And it was perfect for me, to go back there. And I came back to tell Nancy, what? Going back to Boston? Are you crazy? I thought she was going to split. She was very unhappy about that thought. But she was a wonderful wife, and sure enough, we made it back to Boston and Harvard again. So this time I was in the Department of Social Medicine, but I also had an appointment in 2 or 3 hospitals to do surgery, and in addition to that, I was also working in the operating room. So it was right back to surgery, social medicine, and teaching philosophy. So they said, okay, Lynn, you develop a course in medical ethics for the fall. So starting out in June, I spent the next 3 months developing a course that I thought would be top-notch. It was going to have all kinds of Rawls, philosophers, some medical people, etc., etc. And it was fun, and I really enjoyed it. I showed it to Nancy so she could approve it and everything. And then on September something like the 12th, before the classes started, I had to appear before a special faculty committee that approved all the courses that were going to be required. This was going to be a required course. That's a big deal in the medical school. Almost anybody can offer any kind of course they want, but to require it for graduation was big deal. So I spent a lot of time thinking about this and all the different things to put in it, etc. And then in September, again, I appeared before the select committee and spent about 10 minutes going over this 13-page syllabus that I had prepared and telling him why this and that and the other thing were important, etc. And I thought, okay, fantastic. It went well, but all of a sudden in the back of the room, this figure stands right up. And he says in a very loud voice, "We can't have a course in ethics. There's no truth in there." What I mean, oh boy, that was he was the, sort of, if there was such a thing as a president, he was the president of the medical school. He was the leader. I thought for sure I was dead in the water. Of course, that's what I came for, was to give a course in medical ethics. Well, lo and behold, Miles Shore, he's a psychiatrist, he said, "Wait a minute, Henry, don't you think we need a course in ethics?" He turned to one of his colleagues, and he said, "Oh yeah, we need a course in ethics." Okay, so Miles said, "Well, how many people think," this is a group of 28 of the most senior faculty in the medical school, "how many think we need a course in ethics?" Clear majority raised their hands. "Oh, we need a course in ethics." Whammo, right on. And that was it. That was the start of a blossoming activity for me. And I taught that course for the next 5 years and then passed it on to colleagues. And the whole idea here was to develop a unit, to develop a group of people, nurses, doctors, sociologists, etc., to work on things in ethics. And this was the place that we got started. I want to back up in two directions now for a minute and think a little bit about ethics and a course of ethics in a medical school and what that means. And the first thing has to do with the fact that what do you learn by taking a course? What difference does that make? Does that make somebody ethical? No, it doesn't. But it does give them some comfort with terms that might help in difficult situations, and I'll have some examples of that. But I think also, in addition, the other thing is to think about a broader scheme in ethics and a broader scheme in what this was all about. I think in the church, for instance, we have this, in your program, if you notice on the front page, North Universalist Chapel Society. Well, you can actually put North Ethics Chapel Society in there because in some ways, Universalism is a synonym for ethics. It's a synonym for something that is more inclusive than philosophy. It's much more socially oriented as a word. And indeed, in fact, as I look back to some of the older Universalists, there were two special Universalists. Isaac Below, who preached right here in this church back in the early 1800s, and the other one was Benjamin Rush. Now, Benjamin Rush was incredible, and I'll never forget, we had a small group of us, I think Polly and Akanka picked out to talk or to study Benjamin Rush, as I recall, and how important he was in Universalism. Indeed, Rush had the idea right off the bat of Universalism. I mean, that's in this church, North Chapel, was a Universalist church, and that was what Rush was all about. It just sort of captured the sort of breadth of what Rush was bothered by. He lived in Pennsylvania, Philadelphia area. He was actually the initial starter of the Universalist Church in that area. And he reached out to everybody that was in a bad situation. And that was his program for religion, was to reach out. And so it sort of captured an element of the North Chapel, I think, in a way. And again, it's seen on on the front page of your program. The other side of the sort of element of the person, we need an ethics. We don't need an ethics course side, is what we did in the medical school. And we blossomed it into a whole bunch of courses. We had, I think in the end, we had something like 5 different courses in ethics. Research projects, I was involved in 2 research projects. One was looking at the issue of malpractice and patient injuries in the state of New York in, I think it was 2019 or so, no, not 19, 1029. At any rate, we did a 1-year study of surgical accidents in New York hospitals. And we found that there were a lot of things that could be improved. One of the things that we thought was that we could, if we could transfer the insurance funds from the insurance company to the injured person, it would help in the recoveries for persons that had hospital-caused injuries. But that was a no-brainer, a no-go, because the legal aspect of it would not allow that kind of transfer. The other project that I got involved with was a project called the Support Study, SUPPORT, study to understand patient preferences for outcomes and risks of treatment. And that was a 10-year, I think it was something like $26 million study looking at the effect of critically ill persons and how that their recovery could be helped. And that was a wonderful study. We had the project involved having a specially trained nurse to assist patients who had suffered, who were quite ill. And we were able to show that the nurse did make a difference. Didn't make all the difference, but it was a great help. But it was a great pleasure for me to see the movement of ethics into the hardcore medical work, medical establishment. The other thing, I guess, is that what do we do here? I have a good case ready, and I'd just like to see your reaction to this. This was an interesting patient who was about 78 years old, and she had sort of a spontaneous abdominal problem and was brought into the hospital in a state of shock. And she was resuscitated and admitted into the intensive care unit. She had a wonderful family of, I think she had 5 children or so, and their spouses and then grandchildren. They spent quite a bit of time with her. She never did recover consciousness. She remained ill. And about a week into the hospitalization, and we were getting nowhere with her treatment, etc. She'd had surgery and nothing could be done. And her daughter said, her spokesperson, her significant other said, I think Mom's been through enough. I think we should withdraw care. And that seemed reasonable based on the medical facts. And so we were prepared to begin stopping the drips and all that kind of thing. And the daughter said, you know, my mom was a Greek Orthodox. Oh. And it turned out the hospital, the Peterson Brigham Hospital is right next to Brookline. And indeed, in fact, there's a Greek Orthodox ministry or group there. So we called the Greek Orthodox office, and sure enough, one of the ministers came up. This was like 5 o'clock on Monday or Tuesday early in the week, I remember. And very clearly, and he came up with a garment on. He had a special hat, beautiful hat, and then he had this book. The book must have been 3 or 4 inches high, beautifully engraved and pictured and everything. And he spent about a half hour reading from the book. The reading was not the words, it was in a humming kind of language. And the daughter felt so good about that, and the family felt so good. And she then died later that evening. The daughter went home, and the rest of the family went home. And 6 months later, I thought, well, it'd be interesting to see how this has affected their daughter. And I asked her if she would come to one of my ethics classes and tell the students about that experience. And she agreed and came, and it was really something for her to tell the story and to tell how important having that priest, the minister, come from the Greek Orthodox Church, because she knew that would be what her mother would want. She herself was not interested in the Greek Orthodox approach, but her mother, she knew that meant a lot. So I'm going to end with that, and thank you for letting me tell you my stories. We got